Welcome to the April 8th, 2015 meeting of the Trigeminal Neuralgia Support Group for Suburban Detroit. As most of you know, you've seen the agenda in the write-up, but I'm going to let Lynn Rupe introduce our speaker tonight. She was good enough to find the doctor, and it's an area we really haven't discussed now for, I'd say, at least 5 or 6 years. Some of you may remember Dr. Ianni, might even be 10 years now since he talked to the group. But he would talk about much of the psychological side of pain and how it can be like a snowball once you get going. I think you saw the write-up in the letter with some of his background. I didn't put all of that in there. Maybe Lynn will, not to force her to, but maybe she'll remember a little more than I put in there. He has quite a background in the mind-body connection, and he happens to be at Providence Hospital. And I don't think Providence is part of the mergers, is it? Have they merged with anybody?
They belong to Ascension Health, which is St. John.
Oh, St. John, okay. All right, Lynn, you can take over.
Just with us today. I first heard of Dr. Schubiner's work through Dr. Musadi, who spoke to our group a couple months back, and he was explaining to one of our TN members accompanying on a visit about a class that he had taken with Dr. Schubiner and how the mind-body connection can really help us deal with pain. And he gave a story about a doctor who couldn't perform surgery because I'm sure you know the story better, but I don't know the exact story, but basically he couldn't bring himself to cutting because of some past experience that he had, and it stymied him, and he couldn't really practice. And then he learned more about how our mind and body are connected, and how sometimes we have to unlock some of those doors to fully understand just the potential within us to heal ourselves. And it's a fascinating new area that we're exploring, and I'm so grateful to Dr. Schubiner for the work he's done. He went from a pediatrician, is that right, to internal medicine, and has now gone to this mind body.
A little bit of everything.
Yeah, so it's fascinating to see someone who really truly thinks outside the box, and we're so lucky to have you here tonight. Thank you, Dr. Schubiner.
Thank you. Thanks for having me. Thanks for having me. I'm glad to be here. I didn't know it was going to be on the internet, but if I had known, I would have put on some makeup. Would have tried to look a little bit nicer. Well, you'll have to suffer with me as I am. So I've been a doctor for over 35 years, and about 10, 12 years ago I started to begin to explore the role of the brain and how the brain affects pain. And what I learned shocked me, because I didn't know anything about pain after being 25 years as a doctor. And to be frank with you, most doctors don't really understand pain. And to be even more frank with you, most pain doctors don't really understand pain. One, they don't understand the depth of it and how it affects your soul, how it affects everything about you. That part, most doctors don't understand because they haven't experienced it themselves. But the other thing they don't really understand is how the brain functions. Because we have this idea that pain is something that the brain registers when you have pain, and the brain just tells you you have pain. It's just like a black box. You get pain in, you get pain out. But that's not true at all. The brain is the controller of pain. The brain is the controller of our bodies. And that's shocking. I had no idea. And just to give you an example, do you think the mind or the brain can cause paralysis?
Absolutely.
Absolutely. There's cases back hundreds of years up to the present where the brain can cause paralysis. Someone can be paralyzed from the waist down, or from one arm, or both arm and a leg, or whatever, and all the tests are normal, and the body is working normally, but yet they can't move their arm or their leg or whatever. And it's called a conversion disorder. And I've seen people with that, and I've treated people with that. And I'm happy to say I've cured people from that. Not that I've cured them, but I've helped them cure themselves. I had a teenager one time who had, his left arm would be dead. And when I say dead, I mean he can't move it. And he has to put it in a sling. And he started getting better, and he got to the point where, it's kind of funny, he would wake up in the morning, his arm was fine, totally fine. And he'd drive to school, and he'd get to school, arm dead. Put it in a sling, all school day. School bell rings at 3:30 in the afternoon, gets out, leaves school, gets in the car, leaves the grounds of school, arm's fine again. Unbelievable how powerful that is. Can the brain cause cardiogenic shock? Cardiogenic shock is when the heart stops pumping so slightly, so low, that the blood pressure is low, and you need to be in the intensive care unit, and you need to be on what we call pressors. And that's called broken heart syndrome. And it occurs when someone gets a sudden shock. It's occurred literally after someone finds out someone had died in their family, or a plane crash occurred, or it literally occurred one time I read where someone had a surprise birthday party. Which is kind of scary.
Birthdays do creep up.
And it's well known, every doctor knows about it. Can the brain cause death? Well, that seems pretty extreme. But some people have died from voodoo. Right? I mean, it's weird. But voodoo is something that won't affect you unless you believe in it. If you believe in it, it can have powerful effects on you. Have you ever had a hallucination? It turns out Oliver Sacks just wrote a book, the famous neurologist. He just wrote a book called Hallucinations. And he describes how common and normal hallucinations are in normal, healthy people, not people who are schizophrenic. But the brain can cause us to experience things, see things, hear things, feel things that are not physically there. The most common hallucination, and I've had this one several times right now in the modern world, is the feeling that your cell phone is vibrating in your pocket. You ever had that? I have.
Yeah.
It's amazing how common it is.
Just recently, yeah.
Yeah, it's common. It's part of how the brain affects the body. Do you want to improve your mood? I can right now in 10 seconds, I can improve your mood. You want to know how? You take a pen.
Give me $10.
You have a pen?
Write a check.
You have a pen? You have a pen or a pencil? You take a pen, if you have one, take it out. It's amazing how powerful this is. And you take the pen and you put it in your teeth like this. It forces you to smile. And smiling improves your mood. I'm not making that up. It's
Kind of relaxed, too.
It's a scientific fact. It's hard to be in pain when you're laughing, for example. It's different parts of the brain are being used. Have you ever noticed where you hold stress in your body? Have you ever noticed that? Well, I've asked this question of hundreds, thousands of people in audiences, and most people, for some reason, will say, yeah, I recognize that when I'm stressed, my neck is tight, or my shoulders are tight, or my jaw, or my chest, or whatever. I feel a headache. And everyone knows that if you get in a stressful situation, your body will react. I mean, it's not rocket science. It's not unknown. Everyone knows that. Like what happens when you get in a stressful situation, your voice gets hoarse. Just like it's happening to me right now. Anyway. So it turns out, when you think, so is it surprising when you realize how powerful the brain is it possible that the brain could control pain? Control it. And that's shocking. So let's talk about pain in the brain. So this is a friend of mine. He is a carpenter, and he has has a nail gun, and the nail gun sometimes shoots things. Can you feel that? Do you feel pain right now? That is painful, right? So that's a picture of his hand that he took as he drove himself to the hospital. You know how much pain he had? None. He had no pain.
He's been shot.
No, he drove himself to the hospital.
Wow.
He had no pain. So it turns out that pain is a function of the brain. So what happens is that, have you ever seen a child skin their knee? Do they cry? Sometimes. Do they sometimes not cry? Do they sometimes wait to cry until they see their mother come running? And my son, I remember when he was young, he fell on the ice, hit his chin on the ice, his cut, it was bleeding. He didn't even notice. He didn't even know he was hurt. And it turns out that the brain has what I would call a danger signal, an alarm signal, right? The fight or flight reaction is an alarm signal that alerts us to something when we're in danger, when the brain perceives that we're in danger. And so Henry Beecher is a famous surgeon, and in World War II, he studied, he did a survey of soldiers in World War II who were injured coming off the battlefield, and they were in the MASH unit or whatever. And he said, "Soldier, are you in pain? Soldier, are you in pain? Soldier, are you in pain?" Simple question. 2/3 of them said no. They were all injured. So it turns out pain occurs when their signals go from the body, from an injury, to the body, to the brain, number one. And number two, the brain alerts this danger signal, which creates pain. So pain is a function of the brain. Just, it is. It's not a question, it's a fact. Now, once pain occurs, the brain sends signals back to the body, to where the injury is, and it creates a pathway, what's called a neural pathway of pain. Now, how many of you can ride a bicycle? When you learn how to ride a bicycle, what happens? You fell, you know, back and forth, and finally, at one point, you learned how to ride a bicycle. And all of a sudden, you had that moment, you're going down the road, and guess what happened the next time you got on a bicycle? You didn't fall. You knew how to ride a bicycle. Your brain had learned how to ride a bicycle. And every time you've been on a bicycle since then, you just get on and ride a bike. Why is that? Because your brain learned a neural pathway of how to ride a bicycle. Now, neural pathways are how we live our lives. Why am I gesturing like this? How do you laugh? Do you laugh different than somebody else? Do you chew differently than somebody else? You shower differently than other people? Everything we do is based on these neural pathways. That's how our brain and body work. The lower part of the brain, the subconscious part of the brain, the part of the brain that is 95% of what the brain does, controls our body. It's controlling every cell and fiber of your body right now. When you stand up from sitting, that is an amazing feat. It's like riding a bicycle, because your muscles have to change, the muscle tone, the balance, the shifting, the blood pressure, the heart rate, respiratory rate, everything changes all at once in a split second, and your brain is controlling that. So this guy had no pain, despite the fact he had a nail in his hand. Now, I was giving a talk a few years ago, and this doctor came up to me, who was in the audience, and he said, when I was a young man, I was in Vietnam, my company got ambushed, a lot of gore, a lot of casualties. I took shrapnel wounds to my leg, I got medevaced out, came home. Was transferred home, came back to the hospital, rehabbed, everything, pain went away. I was fine. Because what happens once an injury occurs is the injury heals. The injury heals. There are no injuries that don't heal. There are very, very few injuries that don't heal, unless there's an infection or there's a tumor there or something like that. Anyway, so he healed and he's fine. He walks fine, no pain. 20 years later, he's walking down the street, and he gets the same pain that he had in his leg that was originally from the shrapnel wound. And he said to his wife, "God, this is hurting. This is like my shrapnel injury." And she said, "Yeah, that's crazy." And then they look up, and there's this helicopter buzzing by. So what had happened? His brain had learned pain from the injury, It had learned a neural pathway of pain, and the helicopter triggered it. Why do you think the helicopter triggered it? Because he was connected to the pain. It was it's called associative learning. That's how we learn. We learn by associating things. The pain was connected to a helicopter, which was connected to all that stuff that was going on. Okay.
So does that mean every time you use a helicopter now, you get pain?
No,
It's
because
just a one-time,
that's what I do. That's my work. My work is teaching people how to reverse associative learned pain.
okay. So you can teach the brain to unlearn that there's no pain.
Unlearn? Did you say that?
Is that the wrong word?
I'll do a publicity stunt here.
Oh.
And it comes with,
Would you like me to autograph it?
I think he might be able to.
He's a plant. He's a plant.
I have a friend in Los Angeles who does the same work I do, right? He's a social worker. He's a great guy, brilliant guy. Love this guy. And he said, he said to me the other day, he said, you know, I want to write a book, but I can't write a book. I said, why not? You're brilliant, you can write a book. He said, yeah, but you took my title. I can't do it. Anyway, all right, so take a look at this guy. See the nail? It's going all the way through his boot. Now, do you think this guy had pain? You would think so, wouldn't you? This was in the British Medical Journal, and this guy in 1995 jumped off some scaffolding and the nail went right through his boot. This guy was screaming. This guy had severe pain. This guy was rushed to the hospital. They gave him IV narcotics, IV sedation. Didn't really help. They ripped off his boot, and this nail was right between his toes. He wasn't injured. In the article it says a miraculous cure occurred. That's what it says in the article. A miraculous cure occurred. He's like, did you ever see, some of you are old enough to remember Gilda Radner? She goes, oh, never mind. So, what was causing his pain? What was causing his pain was the danger signal in his brain that we all have. We all have a very well-defined danger signal. Because if you don't have that danger signal, first of all, if you can't feel pain, there's a movie about children who were born unable to feel pain. They are in horrible shape. And if you don't have the danger signal, you can't feel fear. The danger signal is important for us to protect us from fearful things. We were, depending on how you believe we were created or evolved, we were either designed or we evolved to have a brain that has this danger signal. And the danger signal has to be very sensitive, because if you think there's a tiger around the corner, you better run, because otherwise, you're a goner. So we all have that. And this guy saw the nail through his boot, and it triggered the danger signal, even though he wasn't physically injured. Now, the important thing to remember then is that pain is caused by two things. One, tissue damage. Well, all pain is caused by the brain, by the danger signal. The danger signal is triggered by two things. One is tissue damage, and the other one is emotional threat. So physical threat or emotional threat. And this was a case of emotional threat, so to speak. And, or some combination of the two. And the second thing is all pain is real. There's no such thing as imaginary pain. Pain is measured by how we feel it, and all pain is real. Because all pain is the same in the brain, whether it's triggered by a physical injury or whether it's triggered by the danger signal without a physical injury. I'm making any sense to you guys? So that's the truth about pain. And most pain doctors, is there any pain doctors here? Most pain doctors don't understand it. I've lectured to pain psychologists, I've lectured to pain doctors, and that doesn't make sense to them. And I think it's true. And maybe I'm wrong, but all pain is real. Pain is activated by the brain. It can be triggered either by tissue damage, but also by neural pathways. Neural pathway pain is reversible by changing the brain. And that's the work that I do. Now, I'm not a TN expert. I've only treated 2 people with trigeminal neuralgia so far. And I'll tell you about one of them later. So I'm going to talk more about pain, and at the end of the talk, I'll talk about trigeminal neuralgia and see how or why or if it fits into this rubric or not. I don't really know. And it may be different for different people, because trigeminal neuralgia may not be the same thing for everybody, right? There's categories and all that stuff. I read a little bit. So pain is a function of the brain. It can be caused by physical or mental stimulus. It can vary from discomforting to overwhelming. People that I've seen, I've been doing this for more than a decade now, and people have I seen, whom I have seen, may have mild pain, may have pain that's totally off the charts. And the severity of the pain doesn't tell me what's causing the pain. It doesn't. What tells me what's causing it is a careful evaluation, which is what I work really hard to do. So, as I said, the danger signal is required for life. When an injury occurs, it sends signal to the subconscious part of the brain. The danger signal is either activated or not activated. If the danger signal is activated, it causes pain. And we also recognize that emotional injury or threat can activate the same danger signal in the brain once pain occurs, because pain is in the conscious part of the brain. Now we're aware of that. This pain pathway then becomes established. And the more pain, the more pain pathway, the more we learn, the more you practice. It's like practicing. And I'm a golfer, so I love golf, and I see a lot of golfers. And there are a lot of bad golf swings out there. I don't know if you've ever seen, watch golfers. There's a lot of bad golf swings out there. And the reason is that people practice, they continue to practice their bad golf swing. And they get better and better at bad golf swings, which is a shame. They need lessons. You don't need golfers, lessons. Anyway, so, and this is the basis of PTSD. Because if you get bit by a dog, you learn to be afraid of dogs. And the more you get bit by dogs, the more you learn to be afraid of dogs. And that fear can multiply. And so the danger signal that I'm talking about, another word for that is fear. And it turns out that pain causes fear. Have you ever anticipated pain? Have you ever been afraid of pain? I mean, how can you not? I mean, pain and fear are really tightly connected. And the reason is that pain is a message. It's trying to alert us and tell us something. And if you break your arm, the message is get a cast. But you can have pain from a broken heart, for example. And the message is, be loving, or forgive yourself, or forgive others, or do something. But it's up to us to interpret the message that our brains and our bodies are giving us. And what I do is I look for the relationships between stress and the danger signal. Because like if you get bit by a dog, you learn to be afraid of dogs. Well, if you grow up in a family that there's a lot of arguing, you learn to be afraid of arguing. If you grow up in a family where there's abuse or neglect or divorce or abandonment, you learn to be afraid of that. And over time, if stresses accumulate, the danger signal becomes more and more sensitized, if that makes any sense. You see what I'm saying? The danger signal gets more and more sensitized if you have more and more stress in your life. And that's just human. I mean, that's how the brain works. And so what I look for is stress or hurts that occur and how that affects the danger signal. And then as people get older, stresses can cause the danger signal to get bigger, and sometimes symptom will emerge. And later in life, they may have more stress, and the danger signal keeps getting bigger, and symptoms may continue, or may persist, or may spread or vary. For example, I see people all the time who have some stresses in their early life that have no symptoms, and then, so let's say you have a woman who grew up with a father who was critical, hypercritical. And when she's 15, she gets a boyfriend, and everything is great until he starts sending pictures of her around the school and calling her names and spreading rumors about her. And then she may end up with some headaches, say migraine headaches or tension headaches. And then later in life, she marries a guy, but it turns out he is hypercritical, or even worse. And then she ends up with stomach pain or pelvic pain. And then later in life, she may get in a car accident, a little fender bender, but her brain is so sensitized to danger that the minor injury to the neck, quote, doesn't heal. It's not that it doesn't heal, it's just the danger signal is so hypersensitive at this point that it goes on, and it's blaring. And then the pain radiates from the neck and goes all the way down to the back. And then along the way, other symptoms may emerge. And in our medical profession, we have a habit of scaring people. So I'm trying to counteract fear. That's my job. My whole life, I'm trying to counteract fear because fear aggravates pain. And so the medical system creates fear, right? You go into, if you get a fender bender, they say, oh, you might have whiplash. If you, if you have back pain, oh, you have a bulging disc. You better be careful. Don't move too much. Better baby your back. Well, creating more fear, creating more pain. We label things. We have lots of labels for things that make them sound really bad. And I could go on and on. But, this person says, I'm not sure I need an emergency room. Is there a reassurance room? And I spend a lot of time reassuring people. Now, can the brain create pain? This is a study from Pittsburgh where they gave people physically induced pain and then they gave them hypnotically induced pain, and it was exactly the same. The brain can create pain, which is identical. Fibromyalgia is a disorder that I see and treat all the time, and it's widespread pain. And we know in fibromyalgia that there is no damage in the body. It's not a physical damage problem. It's a brain problem. The brain is sensitized. But that pain is real. It is not imaginary pain. Chronic back pain and fibromyalgia share this thing we call central pain amplification. So the more pain, the more fear, the more fear, the more pain. And it turns out after a while, the brain is so sensitized to pain that it becomes the problem. So someone may have had an injury to their back, the back healed, but 10 years later, they're still having back pain. It's not because of the problem in the back. It's because of a problem in the brain. And that is really hard to grasp. I mean, that is really hard for people to grasp, especially if you have severe pain and you're saying, oh, it's in my head. They want to strangle me. And it's not imaginary. It's not, people aren't crazy. It's just how the brain works. The brain can cause pain. And here's the study from University of Michigan where they took college students and they gave them physical pain in their arm and they scanned their brain. And they looked at the pattern in the brain. And then they gave them emotional pain and they scanned the brain. Now, how they gave them emotional pain is cruel, kind of, because what they did is they found people who had been dumped by a boyfriend or girlfriend in the past 6 months, and they showed them a picture of that person who had dumped them. That's kind of cruel, isn't it? Anyway, that was the emotional pain they gave them. But the point is that when they had the physical pain or the emotional pain, the exact same thing happened in the brain. Studies from UCLA showed that people who were socially excluded had changes in the brain that are consistent with pain. The anterior cingulate cortex lit up, and they found that social exclusion decreases pain threshold. So emotions are connected to how much we feel pain. The scenario I described with the woman who had difficulty in her life and had symptoms build up, that scenario is like dog bite and fear of dogs. That scenario is kind of like PTSD. It's the same thing, basically. You have a traumatic event, a stressful event, and then you have reaction to it. And it turns out PTSD and irritable bowel, PTSD and fibromyalgia, PTSD and back pain and headache are all connected. They're overlapping. And it turns out that childhood trauma, childhood stress is connected to fibromyalgia. It's connected to migraine headaches, painful bladder syndrome, pelvic pain, irritable bowel syndrome. All those things are connected to stress. And this is an amazing study from a surgeon, a spine surgeon in Los Angeles. He took people who had had surgery for back problems. He assumed they all needed surgery for back problems. I could talk about back pain forever, because that's a lot of what I do. But and then he divided the people into how much childhood stress they had, and he looked at their success rate from back surgery. Now, what does childhood stress have to do with success for back surgery? Back surgery is for bad back, right? Well, it turned out that people who had no history of childhood stress had 95% success with their back surgeries. People who had 1 or 2 risk factors had 73%. But people who had 3 or more risk factors of childhood adversity had 15% success in back surgery. In a study from Stanford, they looked at people who were people over time, over 5 years, and they tested their MRI. They checked MRIs at the beginning and at the end, and they looked at stress in their life, beginning and at end. And the MRI, people who got back pain had nothing to do with their MRIs. It had to do with stress in their lives. Same thing that happened in Norway, another study. And if you take someone who has acute back pain, like going to the hospital, emergency room or something, and you scan their brain, you can predict which people are more likely to develop chronic back pain versus people who aren't likely to develop chronic back pain. And the people most likely to develop chronic back pain are those who have the most connectivity between the nucleus accumbens and the prefrontal cortex, which is an emotionally laden area. It turns out that people who have sensitized brains are more likely to develop chronic pain as opposed to have some pain and it goes away. And what causes sensitized brains? The fight or flight reaction, the danger signal. And what causes the danger signal to be activated? Stress in our lives. When you take people with back pain and you get them to recall a time when they were angry, their back pain goes up and their muscles tighten up. Emotions affect the body. I don't know if there's any athletes here, but people who do athletic events frequently get what they call hit the wall, right? They start getting pain when they're at mile 18 or 20 or whatever, or they start getting tired. And there's a famous exercise physiologist in South Africa named Timothy Noakes. And what he found is that what's happening is that the brain is activating pain or activating fatigue to warn you of danger. You'd think when you're exercising you'd start hurting when you're out of gas, when your energy reserves are gone. And that's not the case. It's like a fuel gauge in a car. A fuel gauge goes on in the car, not when you're out of gas, but when you're going to be out of gas. Your brain anticipates that you're going to be out of gas, and it says, well, slow down. And it makes you slow down by giving you pain or by giving you fatigue. It is that powerful. That's how the brain works. And there's something else I was going to say And the elite athletes understand that. And they just say to their brain, no, I'm not tired. Let's go. We're okay. They turn off the fear mechanism. They turn off that danger signal in order to overcome the part of the brain that's creating these symptoms of pain or fatigue. Does that make any sense? I mean, this stuff that I'm telling you blew my mind. It's crazy. And it turns out that what a lot of doctors call this syndrome, they call it central sensitization. Central sensitization occurs in TMJ problems, and migraine headache, tension headache, irritable bowel, chronic fatigue, fibromyalgia, PTSD, irritable bladder, a whole variety of syndromes that are all connected, because people who have some of these often have others of these. And sometimes what happens is the brain will substitute one for the other. So one will occur for a while, and then that one will get better, and then the other one occurs, and that'll get better, and then the other one occurs, or they build up.
Have you ever met Dr. Peter Ianni? I-A-N-N-I. He's in Farmington Hills. I'm gonna send him a copy of your talk. He talked to us about, it was just, would that have started that thought about 10 years ago, or maybe a little more than that, this theory of central sensitization?
Well,
He didn't know a whole lot about it, but it was something he had come across. He specialized in
well,
pain management.
the term central sensitization started with this guy named Eunice.
How far back does that go?
And that's in the 90s. I don't see a date.
Yeah.
I have his article.
Yeah.
But this concept started in Roman times.
Yeah.
Okay. Ovid, who's a Roman poet, I think, a philosopher, Ovid, said, when the mind is ill at ease, the body suffers. So this is really not a new, a new idea.
Maybe that term is just.
Yeah, but that term is, yeah, you're absolutely
Yeah,
right.
yeah.
And so what I do is I try to understand what the message is. When pain occurs or other symptoms occur, I look really carefully and closely to say, what's the message here? Is this, we know it's a danger signal, but what's triggering the danger signal? How much of this is a physical injury? How much of this is emotional injury, or fight or flight, or fear? Or did it start as a physical injury and shift into a fight or flight reaction situation? And that's my job. I work really hard at that. And so I take histories not only of what the symptoms are, how they come, how they go, how they vary, how they change. I have a friend, this guy I was telling you about in LA, who loved my title of my book, but hated me for stealing it from him. Not stealing it, doing it first. Well, he had pain in his heel about a year ago. And he called me up, he said, Howard, I think my heel is, hurting. I mean, I know it's hurting, but I think it's damaged. Every time I push on it, it's tender to touch, and every time I walk on it, it hurts. And I said, oh, well, maybe you have a heel problem, go see a doctor. He said, yeah, that's what I was thinking. But 3 nights ago, I woke up in the middle of the night, and I went to the bathroom, and I walked back, and I got back in bed, and I realized I had just walked that way, and I had 0 pain. It was totally gone for that time. And I said, aha, that's important. That's important to understand, because it turned out, why would his heel not hurt then? Did the structural damage just disappear all of a sudden? I don't think so. Because when pain comes and goes like that, it seems to me it's more likely to be a neural pathway. What's turning it on, what's turning it off? If your back is damaged, it's going to hurt every time you move it. If your foot is damaged, it's going to hurt every time you walk on it. It's not going to just suddenly disappear. And I said, Alan, I think you're fine. Walk on it. He said, all right, yeah, you're right, thanks a lot. Appreciate it.
Did you bill him?
Did I bill him? He owes me so much money. He has all of his patients emailing me. It's driving me nuts. So what did he do? He started walking on it. He literally started walking on it. It was hurting. But he stopped giving the pain power. He stopped his brain fearing the pain. He turned off the fear mechanism of that pain, even though it was occurring. And he started walking. He started walking back and forth, back and forth. And he started walking back and forth. And he just said to himself, hey, knock it off, I'm fine. He changed the pathway in his brain. 15 minutes later, pain gone. So we can control this pathway. We can control the fear reaction if we choose to. And then I look at people's lives. I look at what's going on in their life, what has gone on in their life, and what went on in their life when symptoms came or when symptoms left, or when different symptoms started. And most doctors don't pay any attention to that, but I do. So I ask, what was your childhood like? Did you have any traumatic experiences? Have you had other of these? I have people make a little checklist, I'll show you that. And I say, you know, what was going on when this started? So here's a patient who I saw. This is fairly typical for me. And I have a list of things like heartburn and acid reflux and irritable bowel and tension headaches and migraine headaches and anxiety and depression and insomnia and fibromyalgia and back pain and neck pain and shoulder pain and et cetera. And spastic bladder and dizziness. And I say, well, just check. Which of these have you ever had in your life? And I have very few patients who have one check. One thing. That's the only thing I had. I've never had anything else. Okay? Well, maybe that's one thing. But most patients have several things. And I find that to be useful. So that's one thing I use. The other thing I use is I say, what was going on in your life when the symptoms started or got worse? I ask, what was your father like? What was your mother like? What was your childhood like? And I have a 4-week intervention program that consists of trying to understand what's at the root. What is the root cause of the symptom? And then, stopping fear, as I said, challenging triggers, taking control, stop giving the symptoms power over us, stop the fear reaction. I do work with emotions and helping people express emotions that are underlying. Sometimes emotions underlie pain, and sometimes people need to make some changes in their life. This is a great treatment for very few people, because most people think I'm crazy. Very few people are interested in what I do, no matter how many symptoms they have, no matter how much pain they have, because somehow what I do seems to be translated into, no matter what I say, seems to be translated into, it's all in your head, you're crazy, you're making it up, it's imaginary, etc. And none of that is true. None of that is true. The truth is that the pain is real. It's caused by the body or the brain or a combination of two. And you can change your brain to change pain. The brain can control pain. So that's what I tell people. I say learned neural pathways are something most people don't understand. But if someone has learned neural pathways, and I have no idea what this applies to trigeminal neuralgia or to any of you, but we'll talk about that in a minute. But if someone does have a learned neural pathway problem, it is reversible. And what I tell doctors is, you need to love your patients. And most doctors, this is not what they do. But I find that to be really important. Now, how common are these learned neural pathway type problems? I went to Stanford, they said, well, we don't have those, our patients don't have that. I go, oh, gee, I must be, well, my patients are the only ones who have this. Your patients don't have this. And I was so angry with them. But it turned out that I had a friend who was working there, and he said, yeah, they do, they just don't recognize it. They're not looking for it. They're not paying attention to this. And I have a friend in Seattle who works in a pain clinic at the Swedish hospital, and he said, when he learned about this work that we do, when he learned about it, he said, since I've understood that the mind commonly generates pain and learned how to recognize that process, I realized the majority of my patients have this. And he's in a chronic pain clinic. So let's talk about TN for a bit. Well, if I understand it right, it's pain that is intermittent, it comes and goes.
That's classic or typical trigeminal. It's not the atypical or
Some people have constant pain and some
Right.
people have intermittent pain.
Right.
And so, if pain is intermittent, why is it coming and going?
The theory is that there could be a blood vessel or vein butting up against the nerve as it exits the brain. And whenever the two meet or whatever, it may cause the myelin sheath to wear off and cause an electrical charge. But the one thing I was thinking of that
The
you hit on
myelin
is,
sheath wears off and then it doesn't wear off?
well, the one thing that you hit on was, I think it
I don't
really
know.
applies, is the fear factor. I have atypical, I don't have the typical, so somebody else should talk about that. But I know in talking with the people over the years, they say it's so bad because they definitely have that fear factor of when is it gonna hit next.
Oh, yeah.
And that definitely, I think, probably affects them.
If you have anticipation of pain can cause pain.
Right.
That I know. Now, if it's the artery, well, the artery's pulsating, so it should hurt every time it pulses. Well, it doesn't do it.
It's still a mystery to the neurosurgeons. There's a
Exactly.
lot of studies going on.
Exactly. I
Yeah.
don't think we really know. Now,
Yeah.
it's triggered by certain stimuli. Can be triggered by wind, by shaving,
Right.
by
Right.
brushing your teeth, by chewing, etc.
Barometric change,
What?
barometric change.
Exactly, lots of things. So, for example, let's take migraine headache, which I know a lot about, and I treat that all the time. Well, migraine is triggered by a lot of things. And it's triggered by certain foods, red wine, sunlight, etc. And there have been some studies on triggers in migraine. And what they're finding is the more people try to avoid the triggers, the worse it gets. Because of the fear factor.
Thinking about it, yeah.
Thinking about it, worrying about it, avoiding it. What they find is that triggers, they've tried to reproduce migraine triggers in certain people, and they haven't been able to show that. And anything that happens has two effects, right? There's the physical effect, and there's the brain effect. Every treatment that we get has a physical effect and a brain effect. So, for example, there's a study that was done with injections for back pain. They gave injection and they gave placebo injection. And there was no difference. But both groups had dramatic reduction in pain. So the people who got the placebo injection had dramatic reduction in pain. Because the treatment, any treatment affects not only the physical, but the mind. And same thing was true for, there's a research study they did on repairing meniscal tears in the knee. And they repaired the meniscal tears in half, and they pretended to repair the meniscal half in the other half, meniscal tear in the other half. And both groups got dramatically better, but to the same degree. So the effect that the brain can have is really powerful. And this one patient I saw with trigeminal neuralgia, she noticed that chocolate was a food that triggered TN pain. Why would chocolate do that? Is there something?
Caffeine,
Huh?
the caffeine in there.
Right, but caffeine didn't do it. Chocolate did, but not caffeine.
Isn't there caffeine in some chocolate?
Absolutely there is. And so she began to wonder, like, I don't think that makes sense. Why would one food do it and not the other food? And she said, I wonder if it's my brain that's doing this, not the actual chocolate itself. And I don't know. Why does it get better for a while and then not get better for a while? Structural issues, in general, don't do that. Most people don't have a neurological deficit. Usually when there's demyelination of a nerve, like in MS, for example, there's loss of sensation, or there's loss of muscle function, or there's, in the arms or legs, the reflexes are abnormal. But most people with TN don't have neurological deficits, which makes me wonder how. So the deficit of if the nerve is damaged, it's only the pain part that's damaged, but not any other parts. It's kind of unusual. And we don't know exactly what is doing it. We really don't know, as far as I can tell. For example, post-herpetic pain. So post-herpetic pain isn't TN, right? But it's a nerve pain. So post-herpetic means you have herpes zoster, shingles, right? You know anyone who's had shingles? It can really hurt, right? It's really painful. And most people, the shingles heals and the pain goes away. But some people, the rash heals and the pain doesn't go away. And it continues, and it can be horrific. Well, I've treated a few people with shingles pain, post-herpetic neuropathy. And I've only treated 3, but all 3 of them have done exceedingly well, just by changing how they think about it. And I was like, and I didn't really have much idea about that. I just took them on because they wanted to be treated, and I didn't know. I know about headaches and my fibromyalgia and back pain. I know that really well, but post-herpetic neuralgia, I didn't know much about it, but I've seen 3 people, they all did really well. Pain gone, or dramatically reduced. Medications can be very effective, but maybe not. Surgery can be effective, but the funny thing about surgery, when I read about it, is the results of surgery are best in the first year. And then over time, the effectiveness seems to get less. Well, I don't understand that. Because if you have a structural problem and you fix it and it gets better, why would it get worse a little bit over time? I don't understand it. So it's another question that just doesn't make sense to me. And so, why are there no neurologic deficits other than the pain? Why is it intermittent, coming and going? Why are there remissions? Why the triggers that are so variable? And why does the effectiveness of definitive treatments sometimes seem to decline over time? I don't understand that. And I'm just new to this. I'm just asking the question.
Well, a lot of those questions are still, by neurosurgeons who have dealt with it for 30 years, still have those questions.
Yeah, they're all good questions.
Yeah, I think they're good questions.
Yeah.
So this is one patient that I saw, and she authorized me to, this is what she wrote to me. So I didn't write this, she said, I was diagnosed with TN 3 years ago. I took Lyrica, saw a chiropractor. My pain was manageable, but I was not pain-free. In the fall, I learned about the mind-body connection. Dr. Sarno is one of my teachers. He's in New York City. He's 91, just retired last year. I always felt that it was no coincidence that the onset of my TN happened immediately following a very stressful and frustrating period in my life. Dr. Sarno's theories and examples made sense to me, but I didn't know how to fix my own problems. Now, what I found when I explain this stuff to people, some people go, yeah, that makes sense, and other people go, no, that makes no sense. And you know, that's fine. I don't know. I don't know if the people it makes sense to are the people that are more like to have this or not. I don't really know. But I do know that some people this makes incredible sense to, and other people it just doesn't make sense to. But it made sense to her. She said she found Dr. Schubiner. I didn't write this. She found my book. She described the process, and she came to see me. She took the class that I do, and she said,
Could you go back on that? I hadn't finished, I'm a slow reader.
Yeah,
On
I
the
mean,
last
it's just,
part.
it's more like, you know, blah, blah, blah.
Okay, thank you.
I was just trying to go through the,
Yeah.
and she said it took about 4 months to reprogram myself. So what she was doing was unlearning her pain. She was reprogramming herself to turn off the fear response, which turned off the pain. She said, I stopped giving power to it. It sounds crazy. It sounds weird, right? But she changed her brain to turn off the pain. She's taking herself off Lyrica. And she said she was in a recently very stressful period, but she still remained pain-free. She said it took a strong leap of faith to believe and embrace the fact that the cause of my pain had to do with things that were happening in my life. Now, most people aren't going to do that. Most people, this may make no sense to, as I said. And maybe it, and you know, for many people it certainly may not apply to them as well. I'm not, I have no idea. But She said, it's hard to imagine that our minds will cause pain as intense and unbearable as the TM shocks and spasms. She had to give up the fear and the expectation of pain during triggers such as talking, brushing her teeth, and eating, particularly certain foods. She had chocolate. I remember chocolate was one of her foods. And now she can eat chocolate, which is great. It took a concerted effort to stop anticipating and bracing for pain, instead to expect no pain. It's worked. I'm no longer afraid. I'm no longer in pain. I took away its power. So that's all I have for you. Like I say, I have little experience with TN as a thing in and of itself, but I have a lot of experience with patients, with people, and with pain in a whole variety of ways. And whether my model, what I do, applies to any particular individual, I don't know. But I work with people very closely to try to sort that out and figure it out. I never make an assumption that what I do applies to somebody before looking very carefully in a detailed way at who they are and what their symptoms are and what their life is.
Does insurance cover it, you know?
I bill, I see people for office visits and I bill insurance.
No problem.
Depends on the insurance, but yeah, generally it's not a problem.
Not
We
a
take
problem.
almost all insurance.
Do you ever use hypnosis in your treatment?
I don't use hypnosis. I use meditation as part of my treatment.
That's going to be my second question.
Yeah, I do. I do use meditation as part of my treatment. I'm not as quite a big a fan of hypnosis, just because I like to put the patient in charge. Hypnosis is kind of like I'm hypnotizing you. I kind of prefer that the patient have the agency to kind of do this work. Oh, I'm sorry. I thought you had your hand.
Other questions from the group?
Your book, where is it available?
My book's available online, Amazon.com, or for my website, it's unlearnyourpain.com.
You know, it does come with a CD, a meditation tape that you can work on.
Yeah, it comes with the meditation CD that I put in there.
So can they order it online too, if you go to unlearnyourpain.com?
Yeah, that's
They can
where
order
that's
it
where the
there.
book's available, or Amazon.com, either one. It's the same. Yes, sir.
The TN's kind of interesting, but when I think about that we can learn what the triggers are and anticipate the trigger might start working again to trigger the pain, but I didn't know those triggers when I started. They
Right.
came of their own accord, so it's like, and the fact, and the thing that always puzzled me is I could be dead asleep at night and have an absolute pain occurrence that would put me out on the floor like that. So that's why I never could think about it as
Well,
a mind
triggers-
control thing.
Triggers are associative learning.
Yeah.
So the trigger for the guy in Vietnam was the helicopter.
Oh, yeah.
He didn't choose to learn that. Brain learning occurs on a subconscious level. And so if somebody, somebody gets has a stressful day and they go to Walmart or Costco and they get a headache and then they kind of notice the lights are bright, then they may start having headaches with the light.
Yeah, 'cause to make that association.
Right, but it's not that they make it, it's their brain makes it. Right? It's an automatic association that occurs. And you can develop triggers by just, if you have a symptom at the same time as a trigger occurs, that will do it. And in the middle of the night, I see this all the time. So I see symptoms occurring in the middle of the night all the time. And the reason is, from my point of view, is that when you're sleeping, the conscious brain is asleep. You're not really awake. But the subconscious brain is very awake. The subconscious brain is in control when you're sleeping. That's what dreams are. subconscious brain deals with emotions from the day. This has been shown. I'm not making this up. This is what the science of sleep shows.
No, that makes sense.
And so symptoms that occur in the middle of the night, and I see it all the time, are typically due to our brain activating something because of whatever it's thinking about, whatever's going on. And it's really, really strange. And it turns out you can control those. That's what I do all the time. And it sounds silly, but I tell people to instruct their brain to not wake them up with pain. I mean, it sounds ridiculous, but you can you can control the neural pathways by consciously taking control over them, and that's what I do. Now, it's not what I do isn't 100% effective. It's not like I have a magic wand and I cure people left and right. I do have many people with really quite amazing responses, but not everybody. I mean, it depends on the person, depends on the situation.
Do you rule out that there is something physically wrong before you?
Yeah. I'm a doctor. I've been a doctor for 37 years. And the very last, I believe in, I don't want diagnostic ambiguity. I want diagnostic certainty. That's my goal. It's all every doctor's goal. The problem is, and the last thing I ever want to do is tell somebody they have a neural pathway problem, when in fact, they have a physical structural problem. That scares the heck out of me to do that. I mean, that's my heart pounding if I'm in danger of that. So I work really hard to look for physical and structural causes in all my patients. But I also work hard to get to the root of the problem and investigate as clearly and deeply as I can what I think is really going on before I decide, and with the patients, we decide, well, is this a neural pathway problem or a structural problem or some of each? So yeah, I take that pretty seriously in my work.
Did you say dizziness can be?
Any symptom in the world can be caused by the brain, because the brain is connected to every cell and fiber of the body. So I see dizziness a lot, ringing in the ears, burning tongue, top of the head. You fix it. You would turn that around. Yeah.
Have you had any success in treating anybody, patients that have inflammation?
Such as?
Well,
Irritable bowel, you mean?
No, just inflammation that just takes over your whole body. I mean,
Okay.
causes arthritic symptoms. I had a prostatectomy a couple of years ago, and ever since then, I've had inflammation where I can feel a pulse in my eyes, in my teeth, in my face, different parts of my body, different times.
So I work really hard to be very clear. I believe in diagnostic certainty, not diagnostic ambiguity. And I work really hard with every patient to try to really understand exactly what they're saying, and what they have, and what they don't have. So now, inflammation is caused by infections. One thing that causes inflammation is infections. Every doctor knows that. So I don't treat infections by changing the brain. I treat infections with antibiotics or antivirals or antifungals. That's one cause of inflammation.
That lasts 2 years, though.
What?
Can't have an infection that lasts 2 years.
Well, you can, but it's rare.
Well,
So my first job number one is there an infection or not? Number two, is there inflammation? Inflammation is also caused by lupus, by rheumatoid arthritis, by other things, connective tissue disorders. So those cause inflammation. That is not infectious. So I look carefully for those. But sometimes people are told they have inflammation when they don't. Inflammation is something you can see, you can test for, you can diagnose. If someone's hand is hurting, I can look at their hand and see if they have inflammation or not. Inflammation is not, you can have what's called microinflammation, but microinflammation doesn't cause pain. So you can have anyway, it may be complicated, but I wonder if you've been told that this symptom in your face is caused by inflammation.
Oh, no, it has nothing to do with TM, that's,
I'm not talking about TNA.
Oh,
You said
oh,
you said inflammation.
oh.
Didn't you?
Yeah, well, that just one place that it exhibits itself. I mean,
Okay.
it goes to different parts of my body at different times.
Well, I don't diagnose people at lectures.
You sound like you need an appointment.
That sounds like I need an appointment, yes, I do.
But I would be very careful about attributing a symptom to inflammation unless there is inflammation.
See,
That's all I'm saying.
Before prostatectomy, I never had this.
Right,
After, it's been a 2-year battle.
right. So the question is, what did the prostatectomy do? Did it cause inflammation?
Or did it scare you shitless?
Yeah.
Probably.
What's a prostatectomy?
Huh?
Prostate surgery.
Prostate
Oh,
removal,
I see,
yeah,
got it.
yeah.
I mean, I wouldn't think prostate surgery would cause whole body inflammation. Doesn't make sense.
Mine was so bad that I was supposed to have it done at Beaumont, and Dr. Seifert, I think at Beaumont, said he couldn't do it because my prostate was too big. He'd never taken one out that size.
So it could be fear factor.
So, when I was overhearing you earlier saying to Tim, your TN symptoms have gone away.
Well, no,
Or
they
gotten
just,
much better.
just
Okay.
decreased. I haven't had any really bad ones
Right.
in a couple of years.
So when I hear that, let me tell you a story. I saw this woman yesterday, I think 2 days ago maybe, yesterday. And she had a lot of symptoms, but one of hers was back pain. And when she bent over, it hurt. So I said, all right, let's see if we can do something with your brain to change that. Let's try. So I said, all right, I said, bend over, it hurts. She said, yeah, that really hurts. I said, okay, now stand up straight, get powerful, and tell yourself this: I'm healthy and strong. There's nothing wrong with me. I'm going to bend over if I want. I'm in charge. All this stuff. It sounds stupid, right? It's so stupid. And she said, all right. And I said, say it louder. Say it strong. She said, all right, I'll say it. And then she bent over. Wow, that was better. I said, good, do it again. I'm healthy and strong, blah, 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 blah. Bend over. Wow, it didn't hurt, but oh my God, now it's in my chest. I said, yeah, of course, because they're neural pathways, right? They turn on and they turn off. They can go anywhere. She said, oh my God, it's in my chest. I said, okay, good.
It's really dying.
So I said, okay, so just take a deep breath and tell your chest to relax. You didn't damage it. You just bent over.
It's just your heart. That's
Yeah.
all. Yeah.
You didn't hurt your heart, She said, all right. And she said, all right. So she took a minute. She closed her eyes. She took some deep breaths. She said, now it's moved to my back. And so, I don't want to say anything, like I said, I don't diagnose at conferences, but when you were telling Tim it's markedly better, what I was thinking in my mind is, I wonder if something else took its place. I wonder if something else is going on. So that's the thing I look for. I look really carefully at my patients to really try to figure out what's going on. And if it doesn't make sense to them, then we don't go any farther. We don't do it. If it makes sense, we go ahead. It's just as simple as that.
What are your thoughts on acupuncture?
Remember what I said before, that every treatment has an effect on the body and every treatment has an effect on the brain? Right? So the effect of treatment on the brain we call the placebo effect. If you think you're going to get better, you can have a powerful effect. Placebo effect can be very powerful. So acupuncture and every treatment we have has a placebo effect. Every surgery, everything has, and the bigger like for example, blue pills are more effective than red pills. It's been studied. 2 pills are more effective than 1. Shots are more effective than pills. Injections are more effective than pills. Surgery is more effective than anything. So acupuncture is like a surgery. You're getting needles, you're paying money for it. More expensive treatment is more effective than less expensive treatment. So if you want to go to a good acupuncturist, go to the most expensive one. I'm not kidding. So what do I know about acupuncture? Well, sometimes it works and sometimes it doesn't. Interesting. Sometimes it has miraculous effects and sometimes it does nothing. Interesting. And when you do studies of acupuncture, when you do, they did one study of acupuncture where they compared a brisk, uncaring acupuncturist versus a kind, caring acupuncturist. The people who had the kind, caring acupuncturist did better than the people who had the uncaring acupuncturist. So get a kind, caring acupuncturist if you're going to get one. And other studies have shown when you put the needles on the acupuncture points compared to people who get the needles on non-acupuncture points, both groups get better, but to the same degree. So it's another treatment. It's not one I do. I studied acupuncture in China many years ago. I know a fair amount about it. But again, it's not something that I would particularly recommend. If somebody wants it, great, go for it. But, what?
It's voodoo all the time.
I didn't say that. The voodoo can be very powerful, as I pointed out.
Yeah.
Where is your office?
I mean, what I do, people ask me what I do, and I tell them I'm a faith. When I'm in joking mood, I say I'm a faith healer. I'm not joking, because I get people to believe. This lady here, did you see? One of the things she said, I believed. I don't know if you remember that. She said, this made sense to me, and I believed it. And if people believe, that's changing their brain. That's changing their physiology. And when people believe, they get better. Because you can't shake belief. One of the things I love is when I have patients who believe in God. I love that. Because I say, do you believe in God? They go, yes. What if I tell you God doesn't exist? What are you going to say? They're going to say, you're crazy. I know God exists. Why? Because of belief. Belief is unshakable. And if someone believes in what I do, and they believe that they're going to get better, and they believe that this is a neural pathway problem, then they can take steps to stop the fear. Because if you don't believe this, the fear is going to overtake you. Because fear and pain, as I said, are really powerful and really closely connected. So,
I think a lot of that, when we get the feedback from the copies of our medical records, of MRI reports, and they say all those terrible things about your discs and all of that stuff, it is scary. It does make you more concerned of what's going to happen, and if I'm this bad at this age, and we all age, what's going to be happening.
a study in Finland, they took healthy 21-year-olds, 50% of these healthy 21-year-olds with no pain had degenerative changes in their back, and 25% had bulging discs. So degenerative changes in bulging discs in the back are like getting gray hair. Just means you're getting old. It doesn't mean you're getting sick. Gray hair doesn't hurt. Sometimes when I look in the mirror, it hurts a little bit. It's scary. And the medical profession is in the business of scaring people. And that's it.
Anybody else?
Anyone else?
No more
Where is your
questions? Thank you very much.
I work at Providence in South.
How do I get an appointment? Do I call Providence or,
Do you have cards with you, Don?
Call me. I make my own appointments.
okay, I need a card.
Providence, but what department is that? What department?
I work at Providence Hospital in internal medicine.
Internal medicine.
I'm an internal medicine doctor. Yeah, could have pointed that out, I guess.
So do you prefer that you get copies of people's medical history, or how do you go about it?
Yeah, I always ask people to bring in their medical records and their medical history. People say it's this big. I say, I don't care, bring it in.
You don't need it ahead of time?
Ahead of time is good. It helps. But normally I have people bring it in when they come. I have some cards up here. Oh wait, I have my wife's cards.
Why is that? If she lives with you, that might help too.
She slipped
Is she
her
a
cards in
physician?
my.
Is she a
Let me see
physician?
if I have mine. That's so funny.
Is she a physician as well?
Yeah,
Is
she works at Providence.
Oh, great.
Oh, that might help.
What specialty is she in?
She's a educator. She teaches the med students.
Oh, okay.
Works with them.
Thought we might get her some appointments here.
Can I ask you, do you ever use Botox?
Oh wait, I do have
Did you hear that question back there?
Botox. I don't use any structural treatments myself. Most of the people I see have had unbelievable amount of treatments. Most of the people I see are desperate. You know, they've been through everything. So I tend not to see people who, I mean, at one time I saw a patient from, he came in from Texas, I think, and he'd had pain for 6 weeks. And I said, 6 weeks? Get out of my office. No, I'm just teasing. I didn't say that, but it was so odd because, you know, I mean, patients I have, it's 3 years or 5 years or 10 years or 20 years. That's the people I see. So, you know, I see people that have been through a lot.
But see, the gentleman who came in with the 6 weeks of pain.
With the what? 6 weeks?
6 weeks of pain. Right away, I would think that they had been so healthy, so as soon as they had pain, the fear was so great that they had to get to someone soon.
Yeah, that could be. I mean, I think it was mainly that he was really tuned in to this mind-body. You know, some people, it's the first thing they think. For me, when I get a pain, the first thing I think of is it's my brain doing it. That's the first thing I think of.
Oh, that's good.
Because it's common. And I've had it before, so I know I'm likely to get it again. I catch symptoms from my patients sometimes.
That makes sense.
I really do. I'm
No,
not
I have a
kidding.
sister.
Because you're
she
thinking
says,
about it.
don't tell me anything, because I will have it.
Yeah.
It doesn't matter what it is.
Who said that?
I have a sister.
Oh, yeah, right. Yeah.
It's like
Because I
beyond.
told her as I'm aging, I can feel a little tingle. She said, oh my gosh, now I'm getting, my whole face is gonna
Right.
just turn into a bunch of lines. Don't tell me anything.
Do you remember seeing that?
I see that all the time.
I don't think anybody is here tonight that went and saw the movie that was out, that the TN group put out, that Dr. Casey showed over in Grosse Pointe Park. But it was a comedy thing, and it was done for the proceeds to go to TN group. But just watching that movie, I could feel pain, just because it was all sorts of stuff going on in there, and it's.
Is that the laugh-off thing they're doing, or no? This
It
is
was not
before
the
that.
Laugh Your Face Off comedy event. It was the one with, I forget who the actress is, now deceased, but, it was, remember, is it Michael Pasternak's son that was the movie producer? That did that out in LA, and he had a lot of big, movie stars in it, but it was, I mean, when you're tuned in like that, and like, is your face hurting?
No,
No.
no.
No, yeah.
No.
It is interesting. I don't know if that's just, it's just how we're wired. It's the only way I can think of it.
Once pain occurs, no matter what's causing it, it becomes learned. And if the thing that caused it in the first place goes away, the pain can persist out of the learned pathways.
I believe that.
I mean, that's now. And
Becomes its own entity, the pain becomes its own entity.
exactly, it becomes its own entity. It takes the power of its own.
Do you deal in both intermittent pain and constant pain? Yeah, both.
Yeah, I mean, it's not, to me, the severity of the pain, the frequency, the coming and going, that's not what I do. I do look for the cause. So if the cause is the neural pathway, then I deal with it
Aren't we always making new neural pathways though?
all the time.
Yeah.
What happens to neural pathway pain, it tends to spread over time. If it doesn't, get better, it tends to spread or get worse, because you're practicing it.
So if I have my husband bring in diamonds and chocolate every time I see him, I won't be thinking that we're gonna argue on my face while I'm doing that.
Exactly.
Can you write that out?
Yeah, flowers.
Did you sign this one?
How,
So, thank you all. I'll say, I've got some cards up here, and a couple of brochures.
For those of you at home, we had a great presentation by Dr. Schubiner, and we have his cards if you would like an appointment with him. Also, I wanted to tell you that the articles for discussion, I can send you those on email if you didn't receive them in the first go-around. Also, we're trying to put our videos of the recent speakers on YouTube or the TNA site, and I'll keep you posted on that through our cover letter. We're also in need of funds to help the group. I'll be honest, I haven't done our financial analysis in the last 2 years, but I hope to here in the near future. But we can always use any funds that people can, and not only for our group, but for the TNA headquarters and for the Research Foundation. Again, I think I mentioned we have Dr. Ellen Ayer here next month, which should be very interesting. And then Dr. Inga Grills and Dr. Andrea Rossi. Also, Dr. Guith from Wayne State has contacted me, and he hopes to come and speak to us. He probably won't be here until the January meeting. So over and out. Thank you, Nancy, for running it.